What's up guys, it's Dr. Mel here, and in this video, I am gonna talk and share with you all about myofascial release, or as some people call it, MFR. As you can see, you are here in my beautiful living room. I'm just getting going for the day. I'm not even to the office yet, so I wanted to come on here and share with you before my day gets started, why work with fascia. A lot of patients and clients that I work with, oftentimes if they're high performers, high achievers, maybe they're sitting at a desk all day, maybe you're an athlete, maybe you're an artist, you're a performer, you're moving your body a lot like me in my profession. Oftentimes as we age, if we don't take care of the fascia, stretching really gets us nowhere. Let me explain. I've got some props here with me today. If you imagine this as a muscle, let's say this is your quadricep in your quads, in your legs. A lot of the times, if the fascia, which is the sheath over the muscle, think of like sausage and casein, the sheath over the muscle is the fascia, and if the muscle is bound, that means the fascia will also be distorted, which by the way, you have fascial planes and fascial lines everywhere in your body, from your toes all the way to your head, and it's all connected. And so when our muscles are tight, we have to consider that stretching the muscle only gets us so far, especially if the fascia is wound and bound. And the truth is, when one part of your fascia, let's say in your shoulder, is wound up, that's gonna translate, for example, in your front line, anterior line, all the way down to your opposite hip and down your leg. This is something I look at with every patient in my office, is how are their fascial patterns expressing in their body. So it's not necessarily just stretch the muscle if you're in pain. This actually comes down to one, moving and activating and releasing the fascia and actually activating the right muscle. So before you do anything, whether it's you go on stage, you go to your job, maybe you do a workout, you perform on stage, you speak on stage, make sure that you release your fascia. This is something that I do every single day, whether it's for 2 minutes or 2 hours, depending on what I did the day before or what I have coming up. It is that important. And let me tell you, my friends, it allows me to be more flexible, more mobile, more open. So what I'm gonna walk you through today, by the way, I should mention the fascia is an extension of your nervous system. We have our brain, our central nervous system up here that has a spinal cord that has a bunch of peripheral nerves that go to all your cells, tissues, organs, and glands. Your fascia is like a sheath or a blanket that extends from that literally wraps around all your muscles and, my friends, your organs and glands down here, which I'm gonna show you how to actually release that very gently. You wanna be super specific here because your organs are a little bit more delicate than your muscles. Now, for the purposes of this video, I'm only gonna walk you through some of the major muscle groups. If I were to go through every single point with you, this video would be 2 hours. Maybe I make a course on it for you later. But I wanted to give this to you because a lot of people get foam rolling or fascial release really confused. So I'm about to move my camera and show you. I've got a couple different props though before we get into it. I personally love using a medicine ball. One, because it has a surface area. I use the cap. I just got this off of Amazon. It has a lot of surface area, so I can get my larger muscle groups like my quads, like my glutes. This is something I do to activate my system before the day, before any workout, and I'll actually do it after the workout depending on what muscle groups I worked. So my favorite is a medicine ball if I'm at my beautiful home like this, okay? Now, if I'm traveling, I use a couple different options. This was one that was actually given to me. It's more of a medium to smaller size ball. You wanna make sure it's relatively firm. So if you're gonna get a medicine ball, again, you wanna make sure it's firm, not those squishy ones, because we wanna be able to press into the fascia, and breathing is gonna be really important in this, okay? Because if you're just rolling around in the fascia and you're not targeting the most bound areas where you're probably gonna feel the most tension, you're not gonna get 100% benefit from this, okay? Make sure that whatever sources and resources you're using are firm and they have a wide enough surface area. So a medicine ball is great. If you're traveling a lot like me, I personally like to bring this guy, something you can search on Amazon, or this is from a trainer. It was Fluid Health and Fitness. So I don't even know if they sell these anymore, but I have hung on to this because this was a gift to me and I love it. Now, if you're someone who has a lot of tension and a lot of pain in your body, you may need to start with a tennis ball. Now, obviously tennis balls are a little bit more squishy, so you may not get the big release, but at least it's a start. Now, the most intense is going to be a lacrosse ball. I don't have that with me here today, But a lacrosse ball is really gonna target some of those fine areas, maybe in your pecs, maybe in your lats, maybe all the way in your quadratus lumborum. And if you don't know what that is, it's okay. Now, here's another thing. Here's a little nerd out. A lot of people, when they deal with like shoulder pain or back pain, it often is not the actual source of the pain. It's often coming from somewhere else along the fascial lines and along the neural connections. So you may notice, for example, that you have a release in your hip flexor down here on the right side. And because of that anterior line of fascia that comes up to your shoulder, which, by the way, if you want to go deeper into this, study functional patterns, I recommend the book Anatomy Trains if you really want to know where these fascial lines are and know your physiology, know your anatomy. But you may notice you release in your hip flexor here, and you get a release in your opposite shoulder and even in your low back. A lot of low back problems actually stem from tight hip flexors, tight adductors in your groin, which I know you can't see me, but I'll show you in a moment, as well as inability to expand your diaphragm. So I'm not gonna start with the diaphragm. I'm gonna work my way up the chain. I'm gonna show you one side, all the major points that I hit, and then we'll end with some of the more key specific points. You're gonna come to the ground with me. You can do this with me if you want. So the first one I love to start with is my hip flexor. And for the purposes of this video, I'm just gonna show you one side, okay? So you're gonna come all the way up, and hopefully you can hear me here. I don't have a microphone on because we're doing this old school. I don't even have makeup on for you. So you're gonna find where in your hip flexor, and you wanna be careful up here because all the way up here, going into your groin and your pelvis, is what's called your femoral artery, which is a major artery. So if you're noticing numbness or tingling when you're on a spot, back off of it. It should not feel like that, okay? It should feel like, this hurts so good, okay? So once you find that point, okay, what you're gonna do is you're just gonna breathe. And I'll try to scoot down a little bit so you can see my face. So you're gonna find a point that you're like, ooh, that hurts so good, okay? And then you're just gonna breathe into it. And you're not gonna roll like this, okay? A lot of people don't do MFR correctly. They're actually foam rolling. I think foam rolling is a terrible term. You do not want to foam roll because what happens is you're just rolling over the bound fascia. Think of it as like a knot in your blanket or in a towel. We wanna breathe into that and release it. And you have to remember, your fascia actually has neurological connections. So this is not dead tissue. This is living, breathing tissue that is alive. And so you want to breathe into it, bring oxygen to the system, and allow it to start to release on its own. So I personally love to start with my hip flexors because your hips are the largest joints in the body. So let's address them first, okay? By the way, if you have hip issues, you probably have shoulder issues and vice versa because we are bipedal creatures. We like to walk. Walking, we stood up in evolution. Walking is a central pattern generator. So oftentimes if you're not walking right, there's something going on with the hip shoulder dynamic and your gait pattern, but that's for another video, okay? I recommend doing each point of your body at least for a minute. And then again, remember, you're gonna do both sides, okay? So let's say, okay, I did my hip flexors. Now I'm gonna work down towards my quads. And I always start at the insertion point of the muscle group. So your quads insert up here, they go down to your knee. I like to start up higher where the muscle belly is the biggest, okay? And I usually, if you kind of move a little, you might have to move around a little bit and you're gonna be like, oh yeah, there it is. Now, if you wanna intensify this one, you can curl your leg. Ooh, yeah. So I'm not gonna move, I'm just gonna use my body weight. I have my knee down here to not create as much intensity, but if you want to increase intensity, you can lift your leg up, okay? So there's your quad. Now, I like to stay in the lower half of the body, so if we flip around, we're gonna get the booty, we're gonna get our glutes, okay? This is a big one, is most people, if they have low back pain, if they have constipation issues, if they have hip issues, they are not firing their glutes properly. So get your booty. Here we go. Pull up my pants. Again, I'm just doing the left side. Fine. And I like to cross my leg like this. And I'm just gonna roll around my butt, my glute. Okay, I'm just gonna relax into that. just breathe. Okay, from there, again, imagining that you've done that for 1 minute to 2 minutes. I'm just going through these quickly. Now you're gonna do your TFL, okay? So this is the fascia that people talk about. They deal, like a lot of runners deal with this. It's a big fascial line that goes from your femur all the way down to your fibula and your knee. So again, finding that point, and you can see my feet are on the ground, but if I want to intensify, I can lift my feet up. I like to kind of do this, and just don't go on the bone, okay? The bone is not going to feel good. Ooh, yeah, right there. If you have a desk job or you stand a lot, this is really good. Okay, so again, 1 to 2 minutes, switch sides, or do all the left side of all the muscle groups, then do all the right side, or do the left muscle, right muscle, whatever works for you, okay? Then we're gonna come to the groin, your adductors. This one, I've been doing a lot more recently, and wow, it is amazing. Because your inner line that comes from inside your ankle up here, comes up through your groin, and actually up through your diaphragm to your throat. So this is really great for people who are like singers or speakers, to release the fascia in your pubic bone, because that's gonna connect to your throat and how you sing, how you speak, whatever. As you can tell, I sound a little bit like a man today because I did a lot of singing, and I was at a conference, and yeah, just a lot. Okay, so this one feels pretty good. You can work also down the line and find different points. And then let's go to your obliques / your lat muscle. So this one you want to be a little bit more sensitive because you're on your rib cage. Okay, so your lats attach like right here at your diaphragm, kind of in your side of your ribs that attach up here. So you might find it closer here. You might find it closer to your armpit. Again, just find, where those points are. And as you do this, they're not going to be as intense. So you might be like, okay, that's like, that went from like a 9 to a 2. Stick with it. And again, remember to breathe. Oxygen is our best friend. Okay, I'm not finding much here, but again, this is your lat muscle. Then let's move to your quadratus lumborum, which is a quadrangle, which is a 4-sided shape that goes from your sacrum, your low back, actually up to your thoracolumbar junction, which is that transition from your middle back to your lower back. And it's deep in the muscle group, so you're gonna wanna sit with this one. Come to the side of your spine, that meaty muscle, and just kind of lean into it. Make sure you tuck your pelvis. Don't forget to breathe. This one, if you have anterior tilt, meaning instead of being normally positioned like this, you do this, right? Anterior tilt, you're gonna feel that here. So if I'm doing this, I'm also elongating my hamstrings, okay? So you also probably have some issues with your hamstrings. I also forgot the hamstrings, so let's do that quick. Again, you wanna go right to where the attachment is. And I usually like to sit for this one, just like that. Oh, yeah. Again, you're just finding those points, okay? Now, let's go up to our pecs. So releasing your pecs, your anterior rib cage will probably 85% of the time actually release all that mid back pain that you have, which is, lower cervical, between the shoulder blades, because we're rounded forward a lot of the time. So you got to open up your pecs and your chest. So I just come like this and find, again, if you're a woman and you have breasts, just be mindful. It's usually pretty close to the armpit where the pec attaches, the pectoralis muscle, major or minor. And once you find the point, you might like sigh into it, breathe into it. That can help. Now I realize if you wanna go down from so that's a pec. If you wanna go down from your hamstring to your calf, you can do that as well. I often have to lift myself to get that, so I will often use more of a lacrosse ball. That just works better for me. And you wanna be mindful with this one. So you're gonna come between your shoulder blades and not just like roll and crack your whole spine, but tuck your pelvis to neutralize your spine. And then just allow your body to lay back to open up your heart. And you might find like kind of moving your hands, moving your arms a little bit helps you find that point in your mid-back and go up a little bit, go to the side. This one you might do better with a lacrosse ball because it's smaller surface area and the muscles between your shoulder blades are a little bit smaller than what we've been working with, okay? Again, remembering to do both sides when you get there. Okay, last but not least, just for the sake of this video, we're gonna do deeper hip flexors, which is gonna start to move into your viscera or your organs and glands, and then your diaphragm. So this one you wanna be really mindful of. Find your pubic bone, go right to this side of it, and come to the soft part of your belly. So this is right above your pubic bone. You might feel it kind of on your bladder. So if you have to pee, go pee and then do this, okay? This is also great. Again, you wanna be really gentle. I'm not pushing into it, I'm kind of lifting myself and breathing. You have deep, deep, deep hip flexors that go on the front line of the spine, which is almost all the way back to behind the organs and glands. So this one, it might be better to lay on your back and like roll something or kind of lean into it like this, but just be mindful because you've got your colon here. If you're a woman, you've got your uterus, your ovaries. So you just want to be really careful, which is why I'm guiding you through this, okay? And again, sound is just like a natural thing that I do. Okay, you've done that. Now we're gonna come up to our diaphragm, which is right where our ribs come together, this little part right below our sternum, our xiphoid process. Also be very gentle with this area, okay? I'm gonna come and I'm gonna go just finding, and I'm kind of lifting myself as you can see so I don't boom, go right into my organs and glands. Your pancreas is here, your stomach is here, your liver is here. If you put too much pressure on those organs and they're super activated and super inflamed, you are not gonna be happy. So this is something that requires maybe working with a practitioner to help release the fascia in your organs before you do it yourself. I'm like barely leaning on it. I'm just finding where in my rib cage, where in the fascia, and breathing. So those are some of the key core major muscle groups that I wanted to walk you through when it comes to MFR. Thank you for joining me in this video. If you have any questions or other areas of your body that you're struggling with, comment below and I'd be happy to make another video or send you some more resources. But again, you wanna make sure you do both sides of the body. So I'm gonna probably even that out later. And there's a lot of different nuances, like, you know, you got your biceps, your triceps, you've got all these other different parts of your body. You've got your neck, like there's so many different ways you can work with fascia, but these are the core areas, even your feet, bottoms of your feet. If you're on your feet all day, amazing. That's where you want to use something smaller like this. Okay, friends, thank you for being here. Let me know if you have any questions and let me know what you learned from this video. Comment below, like, subscribe, and I'll see you in the next video.